Hi, my name is Jenea Arnold, and today I'm going to be doing a complete head-to-toe assessment on my patient, Mr. Shane Andrews. You can come in, Mr. Andrews. Right now, I'm assessing Mr. Andrews' gait. He just walked in, and his gait was smooth and steady, and no uncoordination going on. You can have a seat, Mr. Andrews. I'm going to have him then state his full name.
Shane Alexander Andrews Sr.
And I'm going to make a disclosure that he has been tested already, his visual acuity with the Snellen chart, and it was 20/20. Mr. Andrews is alert and he is cooperative. He is oriented ×3 to person, place, and time, and with situation as well. Mr. Andrews, I'm going to then look at your head and note that it is symmetric. There is no abnormalities. His skin is clear. It seems to be moist and intact. I'm then going to assess Mr. Andrews' hair, and noting that it is evenly distributed, that there are no areas of patches or hair that's missing. And I don't notice that there are any bugs or anything coming out of Mr. Andrews' hair. And I'm going to have Mr. Andrews tell me if when I palpate his scalp, if he has any pain.
No.
As I look at his scalp, I want to note that there are no sores, no lesions, and no nodules palpated. After that, I'm going to go ahead and move down Mr. Andrews' face, and then look again to note that there's no drooping, there's no asymmetry. Mr. Andrews, I'm going to then palpate behind your ears, and we're going to feel for his not any swollen lymph nodes, which I don't, which are preauricle and postauricle, and down to his cervical lymph nodes, noting that they are non-palpable. I'm then going to palpate Mr. Andrews' temporal artery, noting that he does have the blood flow going to his brain, to his cranium. Next, I'm going to go ahead and look at Mr. Andrews' eyes, noting that they are symmetric and that he moves his eyes laterally. And I'm going to test this with the 6 cardinal fields of gaze. I'm going to have Mr. Andrews look straight ahead, and he's going to follow my finger as I move my finger. This tests his oculomotor nerve, which is cranial nerve number 3, and it is intact. Mr. Andrews was able to follow my finger with no problem. Next, I'm going to use my pen light and assess Mr. Andrews' pupillary reaction. When I shine my light, I'm going to make sure to assess that Mr. Andrews' pupils constrict when the light is shined. Also noting that both pupils constrict at the same time, noting that it is a consensual reflex. If I had my ophthalmoscope, I would assess Mr. Andrews' optic disc by coming in at a 15-degree angle and then looking into his eye, noting that there will be no edema or AV nicking, and that his optic disc will be sharp, concave. And also, I would dim my lights and look at Mr. Andrews' red reflex, which is a bright glow, which is orange or red, when the patient's eyes, that his cornea and his lens and iris are all intact. Next, I'm going to go ahead and palpate Mr. Andrews' frontal sinuses, and he would tell me if I'm eliciting any tenderness.
No.
And I will also palpate his maxillary sinuses and have him tell me if there's any tenderness.
No.
Next, I would look at Mr. Andrews' ears. I would do a tug test to note if there's any tenderness and palpate both ears. Are you having any pain when I tug on your ears?
No.
And then with my otoscope, I would look into Mr. Andrews' ears at his tympanic membrane. And in the ear canal, I would note that there's no redness, no swelling, and no pain elicited. And when I look at his tympanic membrane, I would note that it is shiny pearly gray, and his tympanic membrane is intact with the cone of light present. Next, I would look at Mr. Andrews' nose, and I would have him tilt his head back, noting that his nasal septum is intact and that there is no ulceration. It is also midline. And note that inside of his nose, both nostrils are pink. His mucosa is pink and patent by covering one nostril. And have him take a deep breath in and out. And we will do this on both sides, noting that Mr. Andrews is not having any trouble breathing in and out of his nose. Next, I will have Mr. Andrews say ah.
Ah.
And by saying ah, Mr. Andrews is eliciting his vagus nerve and also his hypoglossal nerve when he pokes his tongues out and says ah. I'm noting that his uvula is midline, his tonsils are at the 0 station beyond the pillars, and also that his oral mucosa is pink. I'm not noting any bad breath or foul odors coming from Mr. Andrus's mouth, and also noting that his lips are moist and pink and intact. Also, I will go ahead and look at Mr. Andrus's swallow reflex. Can you swallow for me? And note that his vagus nerve is intact. I will then palpate behind his neck and have him swallow again. And note that his trachea moves up and down and that his thyroid does not feel enlarged and I don't feel any lymph nodes. Also, I would have Mr. Andrus puff out his cheeks and then smile with your teeth. Show me your teeth. And then frown. Frown hard, make an angry face. And this shows that his cranial nerve number 7 is intact, which is his facial nerve. Next, I will go ahead and assess Mr. Andrus's spinal accessory nerve and have him push up his eye, push down on his shoulders, noting that his spinal accessory nerve, which is cranial nerve number 11, and it is intact. Next, I'm going to look at Mr. Andrus's chest, noting that it is symmetric and he has even respirations and breathing. I'm going to then have him turn to his side and I'm going to test his chest expansion and for tactile firmness. If you could scoot to the edge of the couch. I'm going to put my hands behind Mr. Andrus and have him take a deep breath, noting that my hands are moving equally. Next, I'm going to go ahead and palpate for tactile firmness, which tests for consolidation if there was a suspicion of pneumonia. Can you say 99 for me?
99, 99, 99.
And I would do this anteriorly and posteriorly, and you can hear it.
99, 99, 99.
After that, I will go ahead and listen to Mr. Andrus's lungs, having him take a deep breath as I put my stethoscope onto his chest. Deep breath. When assessing the lungs, I am assessing for adventitious breath sounds, and I will do this to each lobe bilaterally, anteriorly, and posteriorly. After assessing his lungs and his thoracic area, I would then move to assessing his cardiovascular system by listening to the 5 areas of his aortic, pulmonic, Erb's point, tricuspid, mitral valves. I'm going to have you take a deep breath, not deep breath, just relax for me as I listen to his aortic pulse, his aortic artery, which is in the second intercostal space. And I'm listening for the lub-dub sound of S1 and S2, which are his valves opening and closing. This is the pulmonic, which is in the second intercostal space. Erb's point, which is in the third intercostal space. His tricuspid, which is in the fourth intercostal space to the left side of his sternal border. And then the fifth intercostal space, which is his mitral valve, and also the point of maximal impulse, which is in the fifth intercostal space at the midclavicular line. I would then go ahead and have Mr. Andrus lie down and inspect his abdomen, noting that it is flat, it's not distended. I'm not seeing any pulsations or waves, noting that his skin on his abdomen is also intact. We're not going to raise your shirt up. But also noting that he's not complaining of any discomfort as he moves. I'm going to then do a light palpation. I'm going to then listen, not palpate. Listen to his 4 quadrants of his abdomen for his bowel sound, noting that they're all active in all 4 quadrants. And the tinkling and gurgling sound in his abdomen is indicating that his bowels are active. Next, I will move to a light palpation. Asking Mr. Andrus, do you feel any pain?
No.
Next, when I do a deeper palpation, I will try to elicit and see if there's any pain when I palpate in his first right lower quadrant.
No.
This tests for rebound tenderness, which assesses for appendicitis or peritonitis. Next, I will palpate in a clock-like motion in each quadrant. Then I will go ahead and percuss in each quadrant, noting the areas of tympany and dullness. Next, I will go ahead and conduct the Rothschild sign by palpating in his left lower quadrant and trying to see as I press on his lower quadrant to see if there's any pain elicited on the right side, which pushes the bowels towards his appendix. And if he was to have pain, then that would be a positive Rothschild sign. Next, I'm going to use the hooking technique and have Mr. Andrews take a deep breath as I try to palpate the edge of his liver border. Mr. Andrews did not catch his breath, which would have been a positive McMurray sign, which is a sign of cholecystitis, which is gallbladder inflammation. Next, while Mr. Andrews is lying flat, I'm going to go ahead and assess his pulses. First, his brachial pulse, which is in his antecubital fossa, noting that they are +2 bilaterally. Then his radial pulse, then his ulnar pulse, his femoral pulse, his popliteal pulse, his posterior tibial pulse, and the dorsalis pedis pulse. And they're all +2. And if I was to auscultate over Mr. Andrews' abdomen, we would also be auscultating for his renal arteries or his aortic artery, noting that there's no bruise and I didn't feel any thrills. Next, I'm going to have Mr. Andrews bend his knee as I try to elicit the obturator sign and internally rotate his knee and apply pressure on his right lower quadrant, and he is not guarding or showing any signs of inflammation or appendicitis. Next, Mr. Andrews is going to sit up. And I'm going to test his brachial reflex by having him rest his arm in my hand. And with my reflex hammer, I'm going to slightly tap on the tendon in his elbow. And I note that it is a positive reflex sign because it twitched. Next, I'm going to have him scoot back a little bit for me and dangle his knees off the edge of this couch. And I'm going to tap on his tendon right here for his popliteal reflex. And I note that it is positive, it jumps. Next, I'm going to go back and assess Mr. Andrews' hearing. We're doing the Weber test. I'm going to use my tuning fork and tap it. And Mr. Andrews is going to tell me when he stops hearing the buzzing sound. This tests for lateralization of his hearing.
No.
Next, I'm going to do the Ren test. And Mr. Andrews is going to tell me when he stops hearing the buzzing sound.
No.
Do you hear it still?
Yes.
This tells me that his air conduction is greater than his bone conduction. Next, I'm going to test his facial sensation and his lower and upper extremity sensations. You're going to tell me if you feel soft or sharp. Close your eyes for me.
Soft. 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 Sharp. 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 Soft. Soft. Sharp. Sharp.
Next, I'm going to test his olfactory nerve, which is cranial nerve number 1, which tests smell. Keep your eyes closed and tell me, what do you smell?
Some oil, peppermint oil.
All right. The patient stated that he smelled peppermint, which is correct. Next, I'm going to test his coordination and have him do a rapid hand test by flipping his arms back and forth, and note that he can do that positively. Next, I'm going to have the patient stand up, and we're going to do a pronator drift test. And the patient's going to stick his arm straight out ahead, all the way, extend your arm, close your eyes, and I'm going to tap on his forearms briskly, and note that he's not having any drifting. So his coordination and neurologic nerves seem to all be intact. And right now, I'm just going to review to make sure that I can cover all bodily areas. I noted that Mr. Andrews does not have any swelling or edema. He is a healthy African American male, and all his tests seem to elicit that he is healthy. Thank you.